Hello, and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. So let's get started. Today, I'm answering some really good questions. And as a caveat, I can't answer personal medical questions because I'm not your personal doctor. So if your question does lean a little personal, I'm going to change it so it's a little more broadly educationally relevant. So with all that said, let's dive in. But before we do that, actually, and thank you so much to the people who also wrote in to tell me about this. Since the last office hours, I think as I was literally uploading it, Eli Lilly has released more of the versions of the Zepbound vials. So before that video, the 2.5 and the 5 milligram vials were available for purchase directly from the Lilly Direct Pharmacy. And since then, the price has come down a little bit for those. And they've also released the 7.5 and the 10 milligram vials. So for those of you who don't know what I'm talking about, the vials are exactly the same medication. It's from Eli Lilly, the FDA-approved medication, Zepbound, aka tirzepatide. They make the pens, but also they will sell directly to patients with a prescription. If your insurance can't cover it, and you want to pay, and your option is to pay out of pocket, but you don't want to pay $1,000 a month, you can directly pay Eli Lilly for the vials, and it just is a little bit more finicky to use. You have to buy the syringes separately. It's fine. People make it work, but that is an option. And since the last video, they've expanded the range of what is available, which is great news, especially great news for my Medicare patients who often have needed to use this version of the medication to actually be on the tirzepatide. So, anyway, that's what's happened since we last talked. And thank you again to all of you who wrote in to let me know about that as well. So let's get started. First question is the recent shortage and compounding news, along with compound semaglutide being expensive as a rest of life medicine. I want to eventually switch to liraglutide plus something else as a cheaper long-term maintenance program. I'm sure it's not ideal, but better than nothing, or a good idea for maintenance. That is an excellent question. And of course, I can't answer for you personally, but I think as a long-term idea, as a long-term option for people who don't of course want to do compounding, and maybe the out-of-pocket cost is really expensive for them, and they also don't want to do the Zepbound vials that I just talked about. I think that's an excellent option for a lot of people. So liraglutide, if you don't know, is Saxenda, and it is available generic, and there will be more generic versions coming out. So depends on where you are. It depends on what pharmacy you're using. Depends if you have coupons, but it can be a bit more affordable because it's now generic. And also there should be more and more versions of it coming out. So that should help drive down the price as well. So I think, yes, liraglutide plus, for the right person, phentermine, or Contrave for the right person, definitely, or metformin. Those are definitely great long-term options that might be quite a bit more affordable on a month-to-month basis for somebody. So that's a great question. Next question is, does increasing milligram dosages actually help improve weight loss? I've been on 5 milligrams of tirzepatide for 4 months and I've lost 10 pounds. It's just been made available to buy increased doses at $100 per increment. Okay, so what this person is asking is, if I go up on the dose, am I going to have a better result? And the short answer is yes. These are dose-dependent medications. So theoretically, the higher up you go, the more weight you will lose. That is why my goal is usually always eventually to get somebody up to the highest dose. So for tirzepatide, for Zepbound, it would be the 15 milligram dose. My goal is always to get somebody up there, unless they have side effects that prevent that, or unless they've lost a significant, like they've lost all their weight on a lower dose, or there's some sort of, insurance access issue. So yes, the short answer is, if somebody goes up on a higher dose, they will in all likelihood lose more weight. Okay, this next question is a little long. I'm going to shorten it. Hopefully I hit all the key points here. So what about increased pain in existing chronic conditions? My chiropractor suggested eating only meat and vegetables, no dairy, for 2 weeks to see if this helps with my inflammation. Before going on Zepbound, I was following a Weight Watchers plan and doing very well, not losing any weight. This person has also just started Zepbound. I think eating this new way for me helped. I was eating fruit 3 times a day and having low carb bread. Oh, and the doctor said no bread, no fruit. How do you feel about this way of eating with all the issues I have? Okay, so there's a lot. This person has a lot going on. Thank you so much for sharing it. Essentially, what their question is, now that they're on Zepbound, what do I think about this way of eating? And I'll just tell you, of course, I can't make individual medical advice, but I think for anybody who does have, chronic pain, chronic inflammation, I think it's always worth trying. Certainly worth a try if they want to do like dairy free for 2 weeks, see if it makes a difference. Gluten free for 2 weeks, see if it makes a difference. The key is that you have to treat yourself when you're making all these changes. You have to treat yourself like a science experiment, okay? As a science experiment, you can't change more than one variable at a time. You can't change more than one thing at a time. Otherwise, you won't know what gave you the good result or the no result, right? So you have to be very, very, it's annoying. You have to be patient, and you have to be very specific, and you have to track things, okay? So for this person going on a dairy-free diet while they're doing Zepbound, I definitely probably wouldn't do that at the same time. If I was advising somebody, I'd have them be on their kind of maintenance dose of Zepbound and then make a dietary change. And you could if you wanted, but if you really wanted to get specific about it, best case scenario is they've been on their current dose of Zepbound for a while, then they do 2 weeks of dairy free and see if it makes a difference. Get a journal, like pen and paper, your notes app, but just track what I would tell my patient to track what their symptoms are every day. Before they started, what was bothering them. When they say chronic pain, does that mean shoulder pain? Does it mean hip pain? Does it mean knee pain? Does it mean they just feel really tired? Like, what specifically does that mean? If you had to draw on a diagram where it's bothering you, that's what I would tell them, to figure out what the problem is before, and then does it get better if my patient's on dairy-free for 2 weeks. And then they could try, if they don't notice any change, they could try gluten-free for 2 weeks. Or they could do, I think this person was doing also kind of a low carb. And I think all of those are worthwhile experiments, but you also have to go into these with, okay, I'm going to try low carb, but if it works, do I want to do this forever? Because as we know, what the research shows is that it really doesn't matter. And I think a lot of you guys are going to disagree with me here, probably. It doesn't really matter, like low carb, vegetarian, high protein. There are a lot of different diets. And when we've done large studies following people, what we find is it doesn't really matter what people are doing as long as they stick to it. So the number one thing is, can you be consistent? So if you try the low carb or you try the dairy free and you're like, wow, I feel a lot better, then you have to ask yourself, okay, you have to make a conscious decision. Am I going to do this for the rest of my life because I feel so much better, or am I not? Because what you don't want to do is like do it for 2 months and then you're like, oh, I'm not doing that anymore. Stop. Then the results come back. Then what also usually happens is people like forget that they stopped, and then they're like, what happened? Like, I tried this and it didn't work. No, it worked, but then you stopped doing it. And when we make short-term changes, it's a lot of work for our brain to do. And so there's always a kind of tendency to want to give up early. And what I always want patients to do is just whatever you decide, just be very conscious and clear about, am I doing this forever? Or is this actually like, I don't want to do it forever, and that's fine. It's just not the right path for me. So I still need to keep looking to find out like how I actually want to eat. Because if I think about eating this way till I'm 80, I don't want to do that. So you just want to be very conscious about it. So track and make a conscious, informed decision. So if this was my patient, that's what I would tell them. I would tell them, see how you feel, and then make a very conscious decision. You've got to track, and then you've got to decide. Next question. I've tried Contrave, no weight loss, HCG diet, and now Saxenda. I lost a ton very quickly on HCG, but it came back the minute I started to eat normally. I've only lost 3 to 4 pounds on Saxenda, and that was only after I adopted a keto-style diet. I'm 47, feel like nothing is working. What am I doing wrong? I want to lose 25 pounds to get back to my happy weight, which is 135. Do you have any suggestions? Okay, this ties in really well with the other question, which is you have to be so specific about trying to not change a lot of things at once. So if I have a patient come in and they're starting Saxenda, if they feel very compelled, like naturally to change their diet, like go with the flow, fine. But if they are taking Saxenda and they decide, now I'm going to do keto diet, which, side note, I don't really love for patients, but some people really like it. Okay, side note, I'm also going to do this. I would much rather have them just wait till they figure out where they end up on the Saxenda, so we know where that is getting them with their weight, and then try if they want to do keto. Again, not my recommendation, but I would only try that after we really figured out, where did the Saxenda get my patient? Okay, where were they starting? Where did they end up? How much of a difference did that make? And then they try the keto. And then don't change the medication while you're doing the keto, ideally, because you want to see how far, I would want to see how far the dietary changes are going. So, we're all fighting the impulse of, we want results immediately, now, and we want it to be so quick and so easy. But actually, like, in 5 years, if you figured out something that works, you are not going to care if it took you 6 months or 12 months or 18 months. Like 10 years from now, you don't care. You're just happy. You're living the fruits of that labor, of that experiment. So that is such a natural impulse that we want results like that. But when we are impatient, we change a lot of things at once. And then we get confused. We're like, this is working or it's not working. I don't know. This is what happened. You get, again, just, you're a science experiment. That, get the data. Like, put the feelings away, get the data, okay? So change one thing at a time, give it long enough time to work, and remember that when you figure it out and you find what works for you, you're not going to care in 5 years that it took you 2 months longer or 5 months longer. You will not care, okay? So it's really worth getting it right. So if I had a patient like that, I would say, Saxenda, we're going to figure out exactly where you got with that. When you're in your maintenance phase, where are you? What was the difference? After you know where after I know where the Saxenda is going to get them, then if they want to go off and do the dietary changes, they go off and do that. But very specifically, very intentionally keeping track, and also with the idea of this is something I would be doing forever. Does it feel easy? Does it feel like, oh, of course I would do this forever? It's a no-brainer. Or does it feel like, I'm like white knuckling my way through the day? That's a good sign that it's probably not something that's going to last forever. So you're a science experiment, change one thing at a time, and be patient because it really does help you in the long term. Like there's a saying in medicine, probably in other industries as well, like go slow to go fast. Like figure out what exactly you need to, what the exact solution is. Slow down and be patient to find the results, and then you'll get faster results. That's going to do it for today. Thank you so much for watching. If you have questions after this video, you can definitely leave them on this video or on another video, and I will add them to the list. You all have very insightful, very helpful questions, and I think all of these today really helped a lot of people. If you're confused about why you can't eat the way you want to eat, or you can't exercise the way you want to exercise, you should stop being confused and sign up for a consult with me, because I'm spending more time with people just finding out what their blind spots are. So you may not know this, you may already know this. I work as a life coach for people around the world to help with the non-medical aspects of their weight as well. And as part of that, whether we decide to work together or not, I'm going to tell you what your blind spots are. So it's 45 minutes, it's free, and you're going to walk away knowing exactly what you need to work on. So this is like a no-brainer. Sign up for a spot now. I made this announcement a little while ago, and everybody, like most of the spots for this month are gone. So if you are interested, just grab a spot now. Some spots are open for April. I don't know how long I'll be able to do this for. But either way, it's going to be a win-win for you. It's a no-brainer and it's free. So I don't know what more to tell you. Otherwise, I will see you in the next video. Thank you so much for watching, and please be well.